It's a skin issue like none we've seen before. When we received this email plea for help, we knew we had to find this young woman some answers.
I deal with every disgusting body issue you can imagine. For years, people have kept these issues in the dark. When you're in my arena, it's a safe zone. Nothing is taboo. I'm Dr. Jorge Rodriguez, AKA Dr. Disgusting. Tiffany, what brings you in today?
I have 4 huge keloids on both shoulders and my chest.
Wow, these are the largest keloids I've ever seen. How long have you had these?
They started when I was 15. They would grow and they grow out, so then they would push through my clothes. So it almost looked like I had almost like another shoulder.
How has that affected your views of you?
Well, I did my best to cover them because, you know, you don't want people, well, what's that? Well, what's wrong with you? And so to avoid answering those questions, I just kind of stayed away.
Has this affected you emotionally?
It lowers the self-esteem a bit. You just don't feel normal. You don't feel like other people.
Oh, I mean, your eyes are welling up.
Yeah, it's been a long journey. I think the worst part is just hearing, what's that, what's that, what's that?
People can be very cruel.
That they can.
Yeah. A keloid is abnormal growth of a type of tissue called collagen. So this is your skin, and when you have an injury, your body starts making collagen, which is going to be this white foam that comes out. It should stop and should not continue going. But in your case, let's say you have an injury or a cut. The collagen just keeps going and heaping up on itself and bigger and more until it forms what basically is like a keloid. The cells didn't tell it to stop, so it just kept going until it was way too large. Which one was removed?
All 3 of them, and then they all came back.
That must have been really upsetting. You must have felt hopeless.
I just had to live with them. My doctor, they didn't know what to do. It sometimes shoots pain through, so it wakes me out of my sleep.
These are obviously keloids. I'm going to send you to one of my colleagues, Dr. Sonia Batra, so that we can try doing something about this, and maybe you can have semblance of a more, you know, normal life where you'll feel better about yourself. What do you say?
That sounds excellent.
Great. Why don't you give me a hug?
Thank you so much.
All right.
Let's see what happened when Dr. Sonia Batra got a closer look at Tiffany's giant keloids.
So Tiffany, I understand that you saw Dr. Jorge about these, and he referred you here for treatment of the keloids. Has anybody ever tried injecting these for you to kind of shrink them down or soften them or anything like that?
I did have them injected with cortisone. Some areas went down, some areas came up.
Are they itchy? Are they painful?
Everything, pain, itching, burning, sometimes discharge.
What I was planning to do today is a different and newer treatment that we've been using that's been really successful. We're using liquid nitrogen to freeze the keloid from the inside out, and it causes frostbite in those cells that are kind of producing all this scar tissue. The spot will actually look a little bit more kind of dusky black for about a month, and then it just sloughs off. And then you'll just have a flat, much thinner scar. And it also, I think even more importantly, will make it much less painful and much less itchy.
Okay.
The best way to approach this keloid is going to be to do 2 separate insertions. I'm just going to make sure we get it all the way through the keloid. Then I'm going to put a little gauze just to protect your skin under here because it gets really cold. So get started with the top part of the keloid. It's going to get really cold very quickly. So you can see now that it's just starting to form a little bit of frost at the edges. And those, we call those the ice balls, and they're sort of coming from the inside out. And so they're going to meet in the center. It's going to take a while. All that area that's white in the middle is frozen, solid. And that's what we needed to do for this to work. I think part of the reason this was actually taking much longer to freeze is that you have more circulation here that's keeping this a little bit warmer. And that might have actually been perpetuating the keloids too. That's what made them so resistant to treatment. This center part, really, you can see that ice all over. Yeah. I'll go ahead and I'm going to detach this now, and then I'm going to put some ointment and cover it with a bandage. Perfect, well done. So that's it.
Thank you so much.
You're so welcome, well done.